Hello, everyone. Welcome to our podcast. Today we have Napoor Narula. She is a nurse practitioner, and today we're going to ask her some questions regarding the COVID pandemic, how healthcare has changed, and some other issues.
All right. Hi, can you first guide us through your job and what you do on a daily basis?
Okay, so I'm a board certified nurse practitioner. I've been practicing for almost 10 years. I was a registered nurse before. And nurse practitioners, we can work like primary care physicians. We can order labs, we can do order medications, any treatment that's needed. Um, if you come in and see me, I could diagnose your problem. I could do any lab work. I could send medications. That's basically what I do. And I see patients from newborns to the elderly. And I'm primary care, so that means I can see patients with chronic diseases like high blood pressure, diabetes, or any acute illnesses like ear infections, um, bronchitis, sinusitis,
Hmm.
anything.
Okay.
So, as we know, the last few years has been the main health issues have been COVID and the pandemic. So, what do you think has changed in healthcare? Like, what did COVID change over the past 2 to 3 years as a result of the pandemic?
In terms of healthcare, I think telehealth, telemedicine has expanded. We have more um, leeway as to how we can treat the patients before the insurance was not paying for telemedicine visits as much. Now now due to the pandemic, I think that's the biggest change that I've seen, is that people prefer to stay home and they can get you know treated from the comfort of their home.
How effective are these like online
Medicine.
conferences or whatever? Yeah, like because obviously like you guys lack the
Hmm.
physical like touch and like the same
Right.
sense of mobility and um
Right.
like abilities that you can get in
Hmm.
person. So
Hmm.
how more or less effective is it?
Well, for certain patients, you do need you do need them to be seen in person. But for common um, colds, common upper respiratory infections, UTIs, um, if they need imaging, if they, for anything, we can certainly, do that, treat that over the phone or over a video visit, and
Mhm.
and insurance has accepted that, so we do get reimbursed fully for those visits. But of course, if somebody is really needs to be seen, we have them come in or go to urgent care or ER to get
Right.
evaluated in person.
Is that still like really popular today? People choosing to get those treatments from home, or in the past
Yes.
couple of years, people are starting to come back, or
Some people prefer to be seen in person,
Mhm.
um, but a lot of young people,
Mhm.
they prefer to be seen, um, over telemedicine. They don't want to wait.
Mhm.
They can get their, um, problems addressed, without leaving
Yeah.
their home.
Mhm.
So especially like at this podcast, kind of focused on global events
Mm-hmm.
and how they relate to like our community. I think that like especially like in Southern California, like we all have like some kind of like broad, vague grasp of like how
Mm-hmm.
COVID has changed life, especially for like healthcare.
Mm-hmm.
But like looking at like Southern California from when you worked like before the COVID
Mm-hmm.
to now, has there been like something that's like stood out to you about how health itself has changed, or like how like doctor patients and like how your
Mm-hmm.
like cases have changed either because of the pandemic or because of like changing like lifestyles due to pandemic?
What do you mean by changing lifestyle?
Like,
Um,
has there been a certain change in
mhm,
maybe the way that like your hospital operates, or
Oh,
the way that like as a profession you guys operate due to like now as opposed to maybe 5 years
before?
ago?
Well, we're taking more precautions. You know, people are wearing more masks, and
Mhm.
we're triaging patients when they come in and check in. You know, if they're ill, um, you know, I mean, some people don't wear masks anymore, but
Mhm.
I think if they're ill, they could be seen outside, or there's isolation room, or they can get tested. So it's a lot of changes that way, because before, you know, we didn't know such things, so we were just treating anybody. But now we do have to keep that in mind, that, you know, people can be ill and it could be COVID. So people are wearing more masks. We're sanitizing. A lot of those kind of things that we're doing, which we didn't do as much before,
Mhm.
especially the masking. Hmm.
Yeah, some of those changes you mentioned, are there
Hmm.
kind of being more precautions being taken since there's a new like wave of like monkeypox coming? Or do you think like in your preparation for COVID, you kind of like covered all those areas where you've made like changes to ensure like more safety for everyone?
Yeah, I think so. We did, because of COVID. Um, but monkeypox is it's a different population altogether. It, it's not as prevalent so far. We have seen
Mhm.
some, but the way it's transmitted, it's a little bit different than COVID. Yeah, but definitely, we're taking all the precautions.
Kind of going off of that,
Hmm.
in Southern California, like as actually even globally, like recently the past, like with monkeypox, with
Hmm.
COVID, different variants and all, it at least to like the average person, it seems like there's like a recent surge in like large scale pandemics or large
Hmm.
scale diseases. Would you say like that's more of like maybe like a coincidence of like just like a string of like like illnesses, or would you say it's like something that we're doing like either like society wise or like lifestyle wise that's caused this recent uptick in?
Yeah, it seems like it, doesn't it?
Yeah.
Yeah, uh-huh. Yeah, we think about that too. You know, all of a sudden we have all these
Uh,
problems. But really, there's no correlation, I think, between the different types of diseases that's coming up. It's COVID is something new. It's just there are different variants. Um, it's just it's kind of hard to control, but because people have been vaccinated, you know, the symptoms are not as severe, and I think we're going to be living with that like a chronic disease.
mhm.
There, so yeah, I think it's just, yeah, it's the COVID with the variants, and then the monkeypox. Yeah, that's something new. And then there was another case of polio
Mhm.
in New York. So yeah, it just seems like it's a coincidence, but I don't think there's much
Correlation.
correlation. Yeah.
Yeah. Do you think there's going to be like similar variants to how there was for COVID? I mean, even though they're like
Mm,
transmitted differently, do you think
yes.
that could also happen?
For monkeypox?
Yeah, for
Monkeypox.
monkeypox, yeah.
They're all viral diseases. Um, it could be. Who knows? Yeah, it could
Mm.
be. Monkeypox, we haven't really seen before. It was mostly in the different continent altogether, and now
Mhm.
they're making their way to America. So um, yeah, who knows? Yeah, it's hard
Yeah.
to tell. There may
Mhm.
be. Yeah.
Mhm.
So for COVID right now, we see for like the testing, I've done like electronic testing. You do a nose swab, you put it into the tester, and you download
Yes.
the app, and it
Yes.
basically tells you if you're positive or negative.
Hmm.
Do you think like these type of new technology will like impact future like the healthcare industry?
The testing itself.
Yeah, the testing itself.
Well, we do have it's these rapid tests for various illnesses. We have the strep throat, you know, we have STDs and whatnot. Um, yeah, I think it's good that people are testing at home for COVID. Um, yeah, I think these tests are good. It gives the results fast. They're pretty accurate. Yeah, so I'm sure we'll see more of these in the future.
So
So you can go.
yeah, so to kind of add on to the topic of COVID, um, recently, just in the world and in the country, there's been a lot of misinformation about COVID, whether or not vaccines are effective. So whether or not COVID is actually like a real threat to the immune system. So what do you think about the misinformation being spread? And as a healthcare provider,
Hmm.
what is your opinion on those opinions that don't take it seriously?
People who don't take COVID seriously?
Yeah, or people who don't believe in the vaccine.
Oh, that's you're always going to meet people who don't want to do vaccine. That's their free will. That's their right. Um, but definitely, the vaccine has proven that it prevents severe illness, hospitalizations. Um, can't really change other people's mind. We could just give them information.
I want to go back to Brian's question. Um, as Brian said, with like new technology and stuff, especially like where we live in Southern California, where there's more like resources, money, and like technology being funneled in, is there maybe some like fear or some anticipation that healthcare is going to change to where it's more like every other industry, like more like technology based, and then like jobs for like people like you, like or like other like primary healthcare providers is getting more like digitized to where like people in the healthcare industry are going to be like losing jobs to computers and AI? Is there some kind of like worry, anticipation? What's like the feeling about that like in the industry?
I don't think so. I think people will always be sick and they'll want to be seen. And I don't think we have the fear that technology will take over and we're going to lose jobs. I think we're going to work with technology to enhance patient care, if anything. And telemedicine is like the first step right now. So who knows how it's going to be later on.
Right.
Yeah.
Mhm.
Kind of like talking more about like the infections and viruses. Like,
Mhm.
do you think like the current wave of like, because now we always see like a new variant or a new type of like virus
Mhm.
coming out every 3 to 5 months. Like five
Mhm.
years ago, like we didn't have that issue. Like, do you think like
Mhm.
something like this, where like every 3 months you see a new like variant? Do you
Mhm.
think like
Mhm.
that's gonna be ending anytime soon, or you think like, or what are some steps we take towards kind of like preventing that, or is there anything we can really
Mhm.
do?
I don't think COVID, from what I've heard, it mutates. So I think we should be ready for more variants. And I think we could prepare ourselves by getting vaccinated whenever, if we're eligible. We
Mhm.
should be up to date on the vaccines. I think that's what we can do right now.
Yeah.
We don't have a
Mhm.
cure for it, but there we can get vaccinated. We could read the CDC guidelines and just be up to date on this COVID.
Mm-hmm. I want to shift our conversation more to Southern California and like
Hmm.
that area. Um, Obviously, because of like people's like wealth and like
Hmm.
resources here, we're kind of isolated from the the brunt of the impact that other like more like rural or like poor
Hmm.
like communities face. So, do you think that's really like all there is to like how hard like places have been hit? Like because we have the money to take care of ourselves, like do you think that a lot of like the disparity in
Hmm.
people in like more like smaller areas getting like dying more, or like getting like more like, because I feel like even though like we get like infected a lot, you don't really hear like much about people like getting like life-threatening like illness or like dying too much in this area, like as opposed to like other areas. So do you think that that's really like the like that I guess what's behind this, like just our access to like money and healthcare, or is it more also, or is it more than that?
I think in America we're pretty good. I think we have good technology, hospitals. Um, I think it's more people who are just the people who are dying, who are hospitalized. It's just that's their choice because they can make that choice. But other countries, I mean, you know, I'm sure they wish that they could have choices like we do, and I just think that yeah, definitely we have more resources. We could get people treated in time versus other countries
Um,
and places. Yeah.
to go back to Vish's question about um, what would you say? Because we all live in,
Mm-hmm.
as Vish said, the Southern California bubble, but uh, obviously living in America where we have access to better
Mm-hmm.
resources, better healthcare than other countries. But how would you compare, for example, the resources we have here and the wealth we have here to other parts in the country where people are not as wealthy, such
Mm-hmm.
as, I heard about, some places in the South where
Mm-hmm.
they got certain like socioeconomic groups like being hit very hard by COVID. So do you
Mm-hmm.
think so my question is, do you think that the deaths and
Mm-hmm.
COVID hitting harder is because of, wealth and access? Or do you think it's because people are not like listening to the CDC guidelines, or what do you think?
Mm-hmm. I think definitely. I think here in Southern California, um, we have more access to everything. We have more wealth, and unfortunately, that does correlate with socioeconomic disparities and education. Education is really important. As a whole, yeah, definitely. I think the people in the South, for example, or other parts of the rural countries, yeah, they need to be educated. And the importance of it, I think that's what it is. Maybe they don't have access to, you know, better healthcare. A lot of people don't have access to healthcare. That's really important. Um, and if you have a steady job, that means you have healthcare, and then you have better health. If you don't have a good job, or they don't have health insurance covered, then you're kind of on your own. So that really affects people's health. I've seen that. See that every day, even here in Southern California.
So with the wealth of like the South California bubble,
Mm-hmm.
when the surge first started for COVID, like
Mm-hmm.
China built like a super big hospital
Mm-hmm.
in a couple of days.
Yes.
Did you see like an expansion of new like hospital beds, like more doctors coming in here?
Here, yeah, definitely. We were a lot of people were called. A lot of nurses were called to go work in the ER to help care for these patients, during the beginning of the pandemic.
So on this podcast, every episode at the end, we ask two questions to go along with the theme. So as we were talking about like changes in healthcare, my first question to you would be, what do you think to like match these changes in healthcare and how like the industry's been moving, like to obviously like to meet like what they need to do for COVID, monkeypox, like whatever. What like legal or like legislative change do we need to make the jobs of people like you easier? Like if there's like one thing that you could get changed from like like maybe like a legal or like liability or like kind of like a more like
Hmm.
process, like the process itself, what would you change to make the whole healthcare like process easier?
I think we should offer healthcare to everybody. Insurance should be available to everybody because the sickest people that I do see, they don't have any insurance, and they're the most ill. They have chronic diseases. They don't have money to pay for medications. Sometimes they take medications and they save up, and then they don't take their medications every day like they're supposed to be taking, and their health deteriorates. So definitely, um, insurance for everybody.
And then kind of like Sid said, we live in like a well-off bubble, kind of isolated from like the problems like more like worse like places.
Hmm.
But even in our like bubble, what do you think we like as everyday people could do to one help with like just overall like our health and like other people's health, or help with just the overall like changes in the healthcare profession right now?
I think everybody should go in the healthcare profession, honestly, just because there's a need for it. So many people are sick, and there's. I think that's what it is.
More people.
Yeah, more people. I think we can always use more people,
Mm-hmm.
to help out.
Sweet.
There's so many shortage of healthcare workers everywhere.
Mm-hmm.
Yeah.
Okay, well, thank you for your time. We really appreciate it.
Well, of course, anytime.
Yeah, thank you so much.
Thank you.
You're welcome.
Thank you.
Thank
Hope
you.
I helped.
Yep.
Okay, take care. Bye.
Bye.